Dr. Kevin Miller with 𝒉 Family Chiropractic, and I'm going to talk about disc problems today and facet syndromes. So I have my model here, and I'm going to show you what a healthy disc really looks like. If you look at the disc space right here, the yellow is the nucleus pulposus. That's like the jelly donut. If you think of a jelly donut, jelly in the middle, if you press on one side of that donut, it's going to squirt out the other side. Very similar thing what happens in that nucleus. We want to keep that in the center. We don't want it pushing out through the annular rings on the outside of that disc. If it does, that's what we call a bulging disc or herniated disc or swollen disc. And what that does is, here's another picture of a herniated disc where that pushes out, and it's going to come out into the hole where the nerve comes out. And that's where, when you get sharp searing pain that goes down your legs, or maybe it's going down your arms, those are the symptoms that you're going to feel when that happens. You're going to know it because it does not feel good. Let me go back to the normal one. That's a healthy disc there. And then in the back part of the spine, so the yellow thing is your spinal cord, the hole where it goes down. But then in the back of the spine, you have joints called facets. And there's a condition called facet syndrome. If you've jammed your finger before, you know what it feels like. That joint swells up and you can't bend your finger. Well, the same thing can happen here, is whether you're lifting something. Sometimes it's you just lean over and put on your socks in the morning, and that facet, for some reason, it just sprains, and that joint space explodes, and it's just like your finger. You can't bend it anymore, and it hurts. That's when it's going to feel like a knife going in your back. It's going to stay right local. The muscles around your lower back are really going to swell up. So two different areas where that can happen. Now this is if you have a perfectly healthy spine. If you do have arthritis going on in your spine, some degeneration, it's easier for that disc to be damaged where the nucleus comes out. It's going to cause problems, and you can just see the jagged edges here. That's arthritis, bone spur formation, degenerative disc happens, and then the hole where the nerve comes out, it gets smaller. Not only does the nerve go through there, there's blood vessels, lymphatic tissue that go through there, fatty cells. So that space just becomes smaller for that nerve to go through. And all of those areas are called subluxation because it's going to put pressure on that nervous system, and those joints don't move as well. Muscle spasms are going to happen. All that is called subluxation. Can cause all the lower back symptoms. So that's why we want to get you treated, get you better, get you adjusted, so you don't have to deal with all the pain.